Hi, I'm Midwife Lily. I'm here today to talk about how to pick the right soother for your baby. The reason you might want to use a soother for your baby at night time is because it has been shown to reduce the risk of sudden infant death. A soother can help to open your baby's airway and keep that open at night. Plus, you can hear them sucking. And if you're breastfeeding alone can reduce the risk of SIDS, so you don't need to use a soother just for that reason. So if you want to give your baby a soother, the first thing you've got to think about is how you're going to feed your baby. There is a difference between giving a soother to a breastfed baby and giving a soother to a bottle-fed baby, and that's because of something called teat confusion. Let me just explain to you what teat confusion is. This is when a baby can be a little bit confused about what's your nipple, what's their bottle, and what's their soother. And obviously, milk doesn't come out of a soother, so that can confuse them a little bit more. If you are going to choose to breastfeed, I would recommend that you don't give your baby a bottle or a soother for the first 6 weeks of their life. That's so that you can just get really comfortable with your breastfeeding, and that's so that you can try and avoid teat confusion. This is the most breast-like soother, aimed to design to be trying to reduce as much as possible the nipple or teat confusion. It's got little holes here that helps with the airflow, and it's got a wide latch area so that your baby's lips can go on the top and the bottom, designed hopefully to stay in a bit better. It's soft and it's got a skin-like feel, which is designed to try and resemble a breast. Then there's an ultra-light stay-put soother, designed to stay put in your baby's mouth for longer. It's super light and you can put it any which way in your baby's mouth, it wouldn't matter. Again, it's got that soft design and a matte skin-like finish for familiar comfort. Then you've got ultimate fit soothers that come in lots of different designs. Some of them have a glow in the dark in case you lose it in the night time, and they are all supposed to be able to pop into your baby's mouth any which way because the shield is symmetrical and the teat. So the Ultimate Fit range has a specific dummy for your newborn baby. It's designed much smaller with a tiny shield and a tiny teat for their tiny mouths. They're all orthodontic, and what that means is the vented teats are designed to be gentle on your baby's developing teeth and gums. You might have noticed your newborn baby, as soon as they're born, they just want to suck, and that's because of a sucking reflex that they have actually developed whilst they're still in your tummy. Babies need to suck and it gives them comfort, so that can help with the sucking reflex. So sometimes your baby will cry, and I know it's not nice to hear them crying. Babies need comfort and they get comfort from sucking. So if you need to just quickly change their nappy or grab a quick coffee, sometimes a soother can just give them comfort for that quick moment. Just make sure that your baby definitely isn't hungry before you give them one. I know it can be so overwhelming, so remember, you can always speak to your midwife or your health visitor about which soother your baby might need.